Hey guys, we're here with Austin. He's going to be asking your frequently asked questions about myelopathy. So you may have had that diagnosis given to you in my clinic or another clinic. And so it's very important that you understand this disease process for you to be able to follow along and let us know if things are getting worse. So Austin, what are they asking about?
Yeah, the first question is, what does myelopathy feel like?
So myelopathy is something that doesn't hurt. It's very counterintuitive. Usually you're seeing your doctor for something that hurts. It's not that. It's clumsiness in the hands, it's balance, it's coordination. It's very hard to put your finger on it. This is why it gets missed. This is why it's very frequently misdiagnosed or misunderstood, or people go to the emerge and leave without getting the diagnosis or getting the diagnosis correctly. It feels like sometimes in the fingertips, it's numb. The hands can feel heavy. You'll notice that you have difficulty doing things that you've done for 20 years. So for example, a carpenter who's been, putting a screwdriver into a piece of wood, never had a problem for 20 years. Now you can do it, but it requires a lot of mental effort to do that same task. Someone else who uses their hands for fine motor skills like knitting, crochet, typing, texting, all these things, you'll notice it slows and it becomes more clumsy. And then sometimes people notice their balance and their coordination is off. So you go from walking to using a cane to using a walker and progress that way. And the final thing is the bladder. So sometimes people will notice alongside all of these things that the bladder is producing a lot of urgency, like you have to get to the toilet right away. So those are the main four.
You emphasize the fact that it doesn't hurt. What does that usually constitute?
So when we say it doesn't hurt, so if you pinch on an individual nerve root, it might shoot down your arm and cause pain. Or in your lower back, you've been diagnosed with sciatica, it shoots down the leg. In this case, when it presses on the spinal cord, it doesn't hurt. So when we say, I want you to monitor your symptoms, I'm not talking about monitor your neck pain and let us know if your neck pain gets worse. This is a common area of misunderstanding. I'm talking about monitor your balance, monitor your dropping of objects, your clumsiness. That's what's going to get worse. That's very hard to articulate. Like that's why it gets misunderstood. And you think, well, my neck doesn't really hurt much more. I think I'm okay. Like that's the wrong mentality.
The third question here is, what is the disease progression like?
So we used to think it was this stepwise progression where people would be fine for 10 years and then suddenly get worse. I think we know now that it is a slow, steady progression. It makes you more likely to have falls. And then if you do have a fall and you suddenly jolt your neck, you can have a significant deterioration. But it is slow and it is progressive. And then there are periods where it can rapidly get worse if you do fall.
I think question 4 and 5 go hand in hand. When is surgery necessary, and are there any conservative measurements?
Yes. So typically, if you have we will categorize it and measure all these things during the assessment. But if surgery, if the disease state is very mild, we typically we can watch and wait and try things like physiotherapy. And then as soon as it really starts to objectively show that the spinal cord's not functioning right, so you have hard signs that your balance is involved, coordination, in conjunction with imaging that shows that the spinal cord's actually compressed from some sort of process, they're arthritic or whatever, then we typically recommend surgery early.
The next question here is, what are the different types of surgeries for myelopathy?
So there's different ways of doing it, either from the front of the neck or the back of the neck. So in our clinic, we'll talk about fusions or disc replacements from the front of the neck versus procedures from the back of the neck where we take off bone and fuse the neck, things like that. So it depends on how many levels are involved and what the neck looks like. There's lots of different ways of doing it and specifics, but in general, there's procedures where we go through the front and take discs out, and there's procedures where we go through the back and remove the bone that way.
Another question frequently asked is, when should I go to the emergency department for these types of symptoms or disease?
I think if you suddenly have a worsening of your symptoms, so if you've gone from relatively normal function to sudden weakness, progressive disease, something like that, sudden worsening and numbness throughout the arms, etc. I mean, you need to see yourself to the emergency room. It's uncommon to have that sort of progression, but I have seen it from time to time. The other problem would be, you're more likely to have falls and things like that. So that's just the disease state of myelopathy. If you do have a fall, you can have a sudden worsening, especially in the hands. It's called a central cord syndrome. So if you're already off balance, you have a fall, and now your hands aren't working, it's better to come to the emergency room. We'll see you, we'll assess you, and urgent surgery is now in favor for that disease, whereas 10 years ago, we thought that wasn't the case, and we would hold off on it. Now we're actually operating on these central cords and seeing better results. So.
I think the last question here is there any outputs or anything else I should know?
I think in general, you need to be assessed by a spine surgeon. You need to have an idea of like what the spine surgeon thinks of your disease process. Where are you? If you are mild myelopathy, the most important thing is that you understand this disease process. So you need to be as educated as everyone else to say, here's how I'm going to follow it. Here's how I'm going to test it. Here's how I'm going to monitor it. And you need to let us know, I think my hand function is getting worse. I think my balance is getting worse. I think my coordination is getting worse for these reasons. And so, I think that's mainly is you need to understand the process the best. So we hope that's helpful, guys. Please leave any comments and we'll see you in clinic.